What is genetic chimerism in humans? Imagine living with two different sets of instructions inside your body. That might sound like a story from a science fiction movie, but it is a real condition called genetic chimerism. It happens when a person has two or more distinct DNA profiles in their body. This means some of their cells carry one genetic code, while other cells carry a different one. Most people with this condition do not even know they have it because it often does not cause any noticeable signs or symptoms. Genetic chimerism can occur in several ways. The most common natural cause is when a woman is pregnant with twins and one embryo dies early in development. Sometimes, the surviving embryo absorbs some cells from the lost twin. These cells then become part of the person's body, creating a mixture of two different DNA profiles. This specific type is called tetragametic chimerism because it involves for reproductive cells, or gametes, which are to eggs and to sperm. Another form of chimerism is microchimerism. This happens when a small number of cells from one person end up in another person's body. For example, during pregnancy, a mother may absorb a few cells from her fetus, or a fetus may absorb cells from the mother. These tiny cell populations can stay in the body for years, sometimes for a lifetime. Artificial chimerism can happen when someone receives a blood transfusion, organ transplant, or bone marrow transplant. The donor's cells mix with the recipient's own cells, creating a person with two different DNA profiles. This is often intentional and part of medical treatment, but it can sometimes cause confusion in DNA tests. Most people with chimerism do not have visible signs. In rare cases, someone might have two different skin tones, colors, or patches of differently colored hair. Some might have differences in reproductive organs, but these are uncommon. Chimerism is often discovered by accident, such as when a person takes a DNA test for paternity or ancestry and gets unexpected results. Sometimes, the test shows that a child is not genetically related to a parent, even though they are. In these situations, genetic counseling can help explain what is happening and what it means for health and family relationships. For families interested in genetic testing, it is good to remember that chimerism is rare but possible. If a DNA test gives surprising results, chimerism could be the reason. Talking to a genetic counselor can help clarify these results and guide next steps. Understanding this condition helps us see how complex and fascinating the blueprint of life can be.